The criteria for our hTEE placement, at least at Navicent, we've developed a list, and we're actually tracking our outcomes related to this, but this is our list, and every institution can develop their own specific to their needs. But for us, we used hypotension after a fluid challenge, and this is not after a 500 cc challenge. This may be after, you know, a liter or two and really not seeing any change. Hypotension with initiation of vasopressors, initiation of a massive transfusion protocol, which we see a lot in our trauma patients. This institution of high volume resuscitation speaks more to our potentially general surgery patients that had the perforated duodenum that came back to our OR and received about 5 liters of crystalloid in the operating room. Lactic acid that's elevated or base deficit less than -5. People that have positive sepsis screen. Acute renal dysfunction with the need to determine volume status, whether you're going to give more fluids versus diuresis. We're looking into its effect as it relates to initiation of APRV, airway pressure release ventilation. We're using it also in our traumatic brain injury patients with ICP placement, as we found that, you know, at least in our institution, the neurosurgeons like to keep our patients fairly volume deplete at the potential risking other end organ damage. So this has been an excellent way for us to be collegial with our neurosurgeons and can show them a picture and say, no, this patient really does need some more volume. We have a catastrophic brain injury protocol that we use for our patients that are thought to have non-survivable brain injury, where we're trying to optimize the physiologic derangements of these patients, and the hTEE probe helps us with that. And finally, this is kind of the patient, the one that's the comorbid, whether it be a severe cardiomyopathy, end-stage renal disease, something that it's really important that you understand their volume status, because you would hate to push them into acute decompensation, for example, from a cardiac myopathy or cardiac failure. So this is what we use as our criteria for our mechanically ventilated patients at Navicent Health. But I think what's more important is to look at cases where this criteria is met and how we use the probe. So